Hello, I'm here talking to Mike Petree, who is the founder and CEO of Petree Consulting Inc. Mike, good to see you. I wonder if you can tell us a little bit about the services that PCI provides, and maybe we'll start with what is your connection to NAATP and FoRSE?
Yeah, so about 10 years ago, when we kicked the company off, we were helping people in the National Association of Therapeutic Schools and Programs, NATSAP, to collect data for a large national outcome study. And over the years, we built a software to make it easier to do that, and then have helped NATSAP members and research participants collect their data and put it into a repository. So we got connected because we'd had experience in that world, and FoRSE was created and wants to do a similar project. And so now we're hosting the database. We created the database. We help people get data into and out of that database, and just do anything we can to support the research objective.
Wonderful. Thank you, Mike. What we also want to talk about is what is the service that PCI provides in addition to connecting to FoRSE? What is your software product that you offer, and why might treatment providers be interested in your R2D2 software?
Yeah, so the Remote Research Director dashboard, which we call R2D2, is really designed to do two things. The one thing is just to streamline the workflow of data collection itself, just to get data in from whomever the recipient of surveys are. And then the other piece is to report those data to both people on the ground who are providing direct care services and clinicians, and then also higher altitude for outcomes research. So we integrate with several electronic health record systems, and then we have a rule-based mechanism that we call R2D2 bot, that we work with the providers to determine what surveys go out to whom. Is it like, do we have a special survey for people with a substance use disorder or eating disorder, etc. We get all those rules set up, and we turn the system on, and then support the data collection personnel in collecting data. And we have metrics to show you how well you're doing it, getting those data in.
Mm-hmm. So you have an ability to send surveys out, whether the person is in treatment through kiosks and things like that, or also when they're out of treatment through texts and emails. And so there's a survey delivery service, and then as well as some of the other things you talked about. What other services do you offer?
So we have like critical item alerts that would, and the provider can go in and pick it for any item or any subscale score or the score of a composite surveys. But a lot of folks will like use a suicidal ideation question, and it texts and emails whomever the assigned staff is. So we've got that piece. We've got a clinical dashboard that shows you where everybody is at a particular time in your program, so you can pull it up in clinical meeting and see who needs the most care and whether or not treatment services are working. Mm-hmm. We've got monthly executive reports that just automatically fire out information about the health of the outcomes, as well as the health of the data collection systems.
You also have an incentive ability, right, to do for survey completion, like a gift card dissemination piece, if desired.
That's right. So it's a rule-based system. You guys, whoever the provider is, determines the rules, and then it automatically fires out a gift card or at least a gift card code once the surveys have been completed to your liking.
Great. So it sounds like it's really customizable with what surveys you select, when you send them, how you send them for different patients at different times, and lots of customizability and direct support of the provider.
Yeah, I think so. We've been working on it for a long time.
Yeah, great. Can you show it to us?
Yeah, and this is an example of live data de-identified for an actual client. And this is just looking at the PHQ-9, and it's showing that 4 days after admit, this person scored in the moderate depression range. And then we see that this company fires surveys at regular intervals. So we can see a nice dip here around 130 days into treatment, and we see that move all the way down into the normal range. And I just happened to pull this one client up I don't have discharge data for this client, but you can see this line here. If it said client discharge, then this line would just extend into the future for whatever increment the rules were set to collect post-discharge data. And this is designed really to, like, you could build a treatment plan goal around like the level of depression. You can see the actual responses, and you can click through these to see how there were variations in item responses. So this is just an individual's view, but you can also go to any of your graphs that are scoreable and you can see your aggregate review. So it's a subtle difference. Here's one person, here's everybody who's ever taken that for this company. So this is just aggregating, looks like about 3,686 adolescent responses. Doesn't matter if it's adolescent or adult, that's just who this company serves. So we can see that on average, there's a progression from mild depression down into the normal range by discharge. So these are just two examples of many examples of the way you can cut your data up and try to figure out how to put them to use in your practice.
Great. All right. So it's useful during measurement-based care with the patient, one-on-one, looking at this together, and also for the data people at treatment facilities to look at overall how we're doing with respect to our outcomes, including during treatment and even post-discharge from the survey pushes then. Awesome.
Okay. Yeah, that's it. And one thing I didn't mention is that, so, you know, we facilitate, we help, we're kind of like data collection combines. So we're harvesting these data and putting them in front of people, but we're not researchers. So we subcontract researchers if you want to do a real deep dive into analyzing your data to find out what groups you're serving well and who isn't served as well. So that's a service that we can pair you up with, but not one that we directly provide.
Great. All right. Well, thanks for showing us that. So are you able to give us some any information on cost of this software?
Sure. Our average customer pays $500 a month on a month-to-month contract. It's pretty standard that there's a $1,200 implementation fee. That's for like a single facility. We work special, we negotiate with larger entities that have lots of different sites to bring that cost down. And with smaller sites, we work with them too to try to bring those costs down into a place that they can afford. So it's roughly based on how many folks we have to interact with directly to support the service and how many clients are served. Like we ask, what's your rough average daily census? And that's one of the pieces in our Lewis formula for figuring that out.
Great. All right. Well, thanks so much, Mike. We appreciate your connection to FoRSE, and thanks for showing us your services.